Hi everyone, my name is Hamzah Shaikh and today I'll be presenting my research titled Comparative Analysis of COVID-19 Response in the United States and Germany. So as I was thinking of a research project this semester, I wanted to compare how the US handled the pandemic to another country. And there were a lot of different countries I could have chosen from, but I eventually decided to choose Germany for a number of reasons. First, both the US and Germany are highly developed, high-income nations. Both the US and Germany are known for their strong healthcare systems. Neither the United States nor Germany has any geographic advantage when it comes to dealing with pandemics, unlike countries like Taiwan or New Zealand or Australia, for example. And finally, and most importantly, both the US and Germany share a form of federalism government. And while federalism comes with the advantage of addressing issues more closely at the local level, it can be a particular challenge forming a national cohesive response required by a public health emergency like the COVID-19 pandemic. Despite these similarities, however, both the US and Germany differed quite significantly when it came to pandemic outcomes. From the beginning of the pandemic to March 1st, 2021, the US recorded nearly 3 times as many COVID cases per capita than Germany did. It also recorded nearly 2 times as many COVID deaths than Germany. And so that led me to my research question, which is, what are some of the factors and policies that can help explain the different infection and mortality rates regarding the COVID-19 pandemic in the United States and Germany? In order to answer this question, in terms of my research methodology, I looked at a wide variety of sources. All my testing data, as well as percent positivity data, along with COVID deaths data, came from the Johns Hopkins Center for Systems Science COVID-19 repository. Data on health demographics between the two countries came from either government publications or academic journal articles. And finally, my characterization of policy approaches in the two countries primarily came from news article coverage in both countries. So my research project looked at a number of different pandemic preparedness issues in each country. For example, I compared the health demographics of the United States to Germany. I also looked at healthcare delivery differences between the two countries. I examined how each country approached mask mandates or COVID testing, as well as procurement of personal protective wear. And finally, I examined social distancing policies between the United States and Germany. And some of my most interesting findings are highlighted here. So one thing I came across is that the US has much higher rates of comorbidities than Germany does. Millions of more Americans suffer from hypertension, diabetes, obesity, or kidney disease in the United States than in Germany. And these higher rates of comorbidities can partly explain why the US had much worse pandemic outcomes. These comorbidities increase the chance of complications from COVID, ultimately leading to higher rates of hospitalization and a higher chance of someone dying from COVID-19. I also examined mask mandates between the two countries, and what I found was that while Germany had a unified approach with all 16 federal states passing mask mandates towards the end of April, the United States had a much more fragmented approach. In fact, some states not only refused to pass mask mandates, but they also made it harder for individual cities or municipalities to pass their own mandates. And this fragmented approach in the United States can also be seen in some of the reopening plans, as well as social distancing policies. So while Germany had more collaboration between the 16 federal states, in the United States, each state charted its own path to reopening. And undoubtedly, this fragmented approach led to higher rates of infection, especially in the summer months. And lastly, I just want to briefly talk about testing differences between the United States and Germany. So if you look on this graph at the bottom left, it appears that it took some time for the US to catch up to Germany in terms of the number of tests administered per 1,000 people. And this slow delay was largely due to technical issues in the COVID tests sent out by the CDC to states, as well as a slow regulatory response by the FDA in terms of granting public and private laboratories the ability to test for COVID. Eventually, the US did start testing more per capita than Germany. However, Germany still appears to have tested much more adequately for the virus. And this can be seen in the percent positivity. So, percent positivity is the percentages of tests that come back positive. And so, while the US was testing more per capita, it also had a larger percent positivity through the majority of the pandemic, at least until the fall months. And so, with that, I'd just like to conclude and thank Professor Miller and Kyle Morgan for running the Gardner Fellowship this year. I'd also like to thank Professor Michael Gusmano at the School of Public Health for serving as a research mentor and advisor throughout the semester. Thank you very much.